Welcome to the Centre for Social Impact's public seminar series for this month, which we hold these seminars every month. Today we're very lucky that ahead of Homelessness Week, which is next week, we are hearing from an expert, one of the leading academics on homelessness, Professor Paul Flatau. And I should not speak anymore because we don't want to waste time.
Excellent. So I'll speak for about 30 minutes and then we'll have plenty of time for questions. And I'd like to begin by acknowledging Wajak Noongar land here and pay our respects to the elders of this land. And we're going to cover an enormous amount of material, but not everything that we've done with the Centre for Social Impact. So we'll look at the costs of homelessness, housing first interventions, intergenerational homelessness and so on. But one area that I will miss out entirely is the financing of homelessness services, the social impact bonds, impact investing, that area, because you just couldn't fit it into the 30 minutes. So we'll just leave that one to one side. But we're going to have a retrospective look and thinking forward. And it is Homelessness Week coming up next week. So we're getting in early. But we've also got the National Homelessness and Housing Plan of the federal government that we're gearing up to. So that's sort of like our moving forward is focus on how we're going to influence that plan. And of course, from a research point of view, our concern is to bring our research findings into play in terms of the setting of policy. So we're actually focused on moving forward in a number of different directions, working with a number of different organisations around that. And this is our chance to do that. It also happens to be the week, or about the week, of our 15th anniversary at the Centre for Social Impact. We had a 10th anniversary, you guessed it, 5 years ago. Big party here. I'm not quite sure whether 15 years deserves a big party. It seems a bit strange, but it would be a big party in the city. So it's a good chance to think back on our work. Now, this is a picture of my mum in Manchester City Mission. And that's one of the factors that got me into homelessness. I was doing quite a lot of work in housing and other areas, but her work in the Manchester City Mission, I was always very interested in, and I said that's what I'm focusing on. There she is. She's actually trying to get the little kids off to heaven as well at the same time as looking after them. That's what you did in those kind of missions at that time. But that was the reason for actually the shift across to homelessness from other areas. And the first area that we looked at, this is actually just prior to moving into the Centre for Social Impact, but a lot of the publications came with the Centre for Social Impact. So this is the one area where it started at the middle, was looking at the cost of homelessness, and it still is the area that we're probably the most well known for in our work. And the essence is that economic analyses of homelessness and homelessness programs provide a very strong basis for intervention and are always considered by government. We've always taken the perspective that this is important information, which when we started the work wasn't there at all. There was a big gap in the Australian literature. But that fundamentally we still have to return to a human rights perspective. The right to permanent housing, the right to freedom from poverty and so on. So that's always been our perspective, but we understand how important the economics is, and we have probably made one of our biggest contributions in this area. One of the big contributions is that the cost offsets that we have discovered are very high on average, but very varying. And there was a lot of work that was going on that I was working on prior to moving into this area. The one piece that sort of dragged me into the cost part was work I did on the cost of high and long-term unemployment after the 1991 recession, which had such a big impact. If you think about big shifts in terms of the Australian social scene, it is the 83 recession, and the 1991 recession that fundamentally changed Australia in terms of the social scene. That was a financial analysis, what impact does it have unemployment, particularly with the longer durations that were occurring by 1993 after the 91 recession, but moving on to other kinds of impacts like work on mental health and wellbeing and unemployment. I have been doing work around Indigenous access to housing, that definitely connected into homelessness, and further work around sustaining Indigenous tenancies. But when I looked at a very priority research question, well, it's all set. The question was, what are the whole of government costs and benefits of not preventing homelessness? That's what I reacted to in terms of putting up a bid. And that time, the only work that I could see in Australia was this work by Sarah Pinckney and Scott Ewing. Sarah sadly died shortly after this work, as this work was coming out. And Scott also died later. But they were very important. I met Scott when I was starting to look at this work. And this cost effectiveness project that got going in Western Australia, which was the first major analysis of the cost of homelessness and the cost effectiveness of homelessness programs, based in WA, very widespread in terms of the scope, and had a quant and qual basis to it, really detailed, and had a very strong project advisory group. In fact, the kind of program that we put into place for this is the kind of program we've tried to implement in a lot of our work. It was very on the ground, and I was fortunate to do a lot of the interviews myself with that project. When you look at the cost effectiveness of homelessness programs, what you're looking at is the program producing positive outcomes, differential outcomes over and above what would otherwise be the case? And what is the cost of it? Now, the standard good quadrant is one where, it's a line going out from here. We've got effectiveness, but it's going to cost you something. A more dominant quadrant, of course, is where you get net savings from homelessness programs whilst you're also having an outcome impact. And that's what we were really interested in, because we were aware of an international literature around the cost of homelessness. So therefore, that provided the basis for cost offsets to spending on homelessness programs. And in that work, we did look at two kinds of cost offsets. The one that I'll just present some data on is a population cost offset idea, which is what is the difference between general population costs of the system. So look at, for example, in this case, health and justice costs for the population. What was the differential for those experiencing homelessness, and use that as the actual offset rather than the raw offset. And this is the kind of a summary table at the time. So we worked out program costs, and interesting that the work that we did there was more detailed than any work that we've done since, pretty much, because we took into account capital costs and the opportunity cost of capital along with recurrent costs. And these are dollars of the day taken up at all. And then we looked at health and justice cost offsets per person. And the difference, and of course, what we were finding was the cost offset, meaning homelessness is associated with costs in the health system and the justice system and in other areas. And those cost offsets are turning out to be greater than the cost of the program. And that was the first empirical piece in Australia that showed that. Highly variable. We were presenting average numbers. We didn't actually look at the distribution. We went just a little far by saying per person, if you stretch this out over 45 years with a discount rate of 3%, and looked at the present value of that calculation, what does that look like per person? Of course, we end up with some pretty big numbers here per person. We haven't done that too often unless we've been really drawn into it, because it's not sort of a little far stretch if you keep on saying each year is going to be like the next year, like last year, like the last year, and so on. But you are looking at some very high numbers if you don't intervene, and it does turn out that each year is like the last year. Huge numbers per person. So that was quite influential. The other side of that diagram that you saw earlier is that we're looking at outcomes. So what we were asking, the question was, what is the differential outcomes? Again, relative to the population, what's the differential cost? And that's the cost effectiveness of the homelessness program. So we were interested in question, did you achieve good outcomes out of this? And there was reasonable change here. Notice that we do have on entry private rental public housing. That's because we included the at-risk of homelessness programs, which were about sustaining tenancies at risk. So that's just to give you a bit of an understanding. So WA was well ahead of other states in focusing in on that question right from the beginning of the 2000s. So it had well-developed programs in place. But what we did see in the programs in question when we followed people through, and this was a longitudinal analysis that we did, but not enough people in the follow-up, was no shelter actually went to zero. Temporary accommodation dropped significantly. SAP accommodation rose, then dropped, and private rental and public housing rose significantly. So there was significant housing outcomes. We also introduced the Who Breath at that time, and we did see some increase in quality of life, but at no stage did we get anywhere near the population norm. So quality of life was improving as a result of the programs, but we're well away from population norms. So there was some differential impact. And I suppose this has been maintained through our work, that there's some improvement in quality of life as a result of changes in housing, for example, but that they're not always that dramatic over a long period of time, and we need to work on that in our homelessness programs. And that's something that our research will be feeding into the work on the national agenda coming up. In subsequent work, we did look at the distributions a lot, and there's a high variance. And what we discovered, which has been there right from these studies onwards, is there is in fact a low-cost group where you're looking at close to zero costs, very, very low costs. And that includes even the rough sleepers, high variance, and you can actually cluster the costs up. And so you've got these groups where you've got incredibly high costs and then groups which are low cost. And that leads us to say, be very careful about saying every person costs this, though it's not that at all. The average is this. The variance is high. The standard deviation is incredibly high. Does this mean that the low-cost group shouldn't get support because the cost deficits are low? No, not on a human rights perspective. And generally speaking, cost offsets might be higher in other areas such as tax, welfare spending, that kind of thing in that group. Same that applied when we went into the youth area in our cost of youth homelessness study. And I know you can't see all these numbers directly, but the PowerPoints are available online, I hope. They're all here. You can actually go onto the Teams meeting and get them as well. Or go to the CSI website and find them. But very, very high variance that you see here. And big difference with the youth group was a very high interaction with youth justice. So justice costs were as big as the health costs. So this work that we were doing in the early period, we found support for throughout our work. So it's been pretty significant constant, the high average costs, the high variance. What I suppose changes with our later work was the fact that we were going into linked administrative data before, during, and after. And the linked administrative data was actually backing up the self-report, because there's always this concern that self-report, overemphasize the costs. What does the actual interactions with emergency and so on look like? And so we actually looked at the real data in terms of linked administrative data, and it's pretty much, there was some differences, but they were pretty equal. So the linked administrative data was really useful in showing differences here. This is a study in West Australia where we looked at those going from homelessness programs and homelessness in Western Australia into fast-tracked public housing, into public housing. And the cost savings that occurred, that was actually pre to post cost savings, not against the counterfactual, but just pre-post cost savings. It was 16 million on these programs. Cost of the programs was much less than that. But the interesting part to this was that a lot of that cost saving was actually in one area, which was the mental health services. And mental health services were such high cost, particularly those with a residential mental health components. And public housing was doing a lot there, really stabilising the situation so that people didn't go back into the residential mental health care. And the savings was very large in that area. Same kind of findings we've had in terms of use of linked data in the Aspire social impact bond case that we recently did, and JTSI. So it's all coming to pretty much the same kind of conclusion. So that was one important body of work, providing the first evidence and continuing evidence that there are high cost offsets in homelessness, and that programs that are successful in achieving housing are moving people into lower cost outcomes. And so therefore, there is a strong regulatory case around homelessness programs. But sometimes that case is overdone because there's lack of awareness of the high variance in those costs. We then started to move into Housing First programs to examine the new Housing First programs that were starting up in the mid to late 2000s. Do you say 2000 for 2005, 2008? That's the time period I'm thinking about, like not 2099 or whatever. Anyway, we're talking about prior to 2010, there was a big increase in the interest around Housing First, which was very Sydney orientated and going to Brisbane, sort of hits WA a little bit later. The results that we get from our Housing First evaluations has been that they have worked incredibly in terms of transition into housing, including from chronic homelessness. But you have to still work very hard at it. It's not a given. And so sometimes the rhetoric sounds too easy. Get someone into housing, that's it. It's not anything like that that we found in the Housing First programs. So there were very high rates of entry to permanent housing, high rates of tenancy sustainability with engaged support workers, but there still remains issues in other areas, particularly employment, social relationships, and we picked up very early the piece, loneliness issue. So this was the first of the pieces that we did, which is the MISHA project, funded by a philanthropist. Turned out that MISHA is actually the name of, can't remember whether it wasn't, Michael was her husband, MISHA was her son, I can't remember exactly, but turned out it had a quite nice expanded name because she, a wonderful person, had funded the Michael project, and then this became, subsequent to the Michael project, Michael's Intensive Supportive Housing in Core project, so it turned out quite well, usually. And that was about supporting men, in this case, into public and community housing at a time of RUD, where quite a lot of housing was coming into play. And what we had was a huge shift into public and community housing and a very high tenancy sustainability rate, reduction in substance use disorder, and we found savings again. So this was self-report savings. And that it was a scattered site for our Housing First approach with wraparound support post-entry into housing. So it was a classic Housing First model, and the evaluation framework was our traditional framework. If people can afford it, longitudinal survey looking at administrative costs and qualitative work. And now we would add in linked administrative data if we can do it. These programs do cost a bit of money, as you can tell here, but they're the best in terms of evidence. One thing that was very clear was that even though we got the huge housing transition, was that recovery was not a simple linear recovery, and it was not easy. It is against the expectation of permanent housing is going to do the job for you 100%. It's nothing like that. And that was where the qual material was coming out, and or Mission Australia's caseworkers were so fundamental in this work. So let's give a bit of an idea of what on the tenancy side it actually looked like. So I think it was around 100 participants at all. 17 had rental arrears, 11 instances of property damage, 25 antisocial behaviour notifications, 6 consumer trading and tenancy tribunal notifications. So what that is telling us is that in that particular cohort, you can expect huge numbers of issues. Why did we get to 89% tenancy sustainability rate? Because the caseworkers were sorting these things out. So around about a third, no problem. A third, lots of problems, and probably would have been evicted, and another third were very strong, absolute 100% eviction cases. And yet we still ended up with 89% tenancy sustainability rates. So it means you have to work very hard to get it right. The thing that was interesting, though, was that there was an increased, and caseworkers worked hard on this, familial and peer relationships, but loneliness actually slightly increased. So there was an issue there, and employment changed marginally. So there is a big question around what does wraparound support actually look like to make it successful, and it needs to have all of these different elements to it. We've done this numerous times. So J2SI was probably the biggest study, and that was a randomized controlled trial. Similar outcomes. 50 Lives, 50 Homes was the first clear case of housing, definitive housing first program in West Australia that was taking on that label, housing first. And there was work done in Sydney around Common Ground, which is congregate housing first, and scattered site housing first programs, led by PhD student Elizabeth Whitaker, who was great. So we came up with those kind of findings. The housing first was working. There have been many studies since, but you have to work hard at it. And you also have to start to really get inside issues around loneliness. Why does it occur? What is it that's doing this? And I can remember going out to people's places and I was thinking, you see the nurse in the house and you're saying, well, you seem to be pretty set just in here in this house. You've got support coming in, but I don't see that kind of deep social relationship stuff occurring. You're very housebound as well. So there is a lot of work to be done in that area. Another big piece of work which we want to really focus in on in the homelessness agenda coming up is the work we did on intergenerational homelessness and early onset homelessness. By the way, there was another piece of work that we're not talking about today, which is service integration. There's been a high interest around collaboration, but empirical piece that we did in the Southeast Corridor here in Perth suggested levels of service integration were much lower than we expected them to be. And there needs to be high levels of collaboration to make it work. But this intergenerational study, I think, was one of the biggest that we've done. And the focus here on looking at the life cycle, looking at this pass-through of the homelessness experience from one generation to another, and also this early onset of homelessness issue that was so evident here and then became evident in a number of other studies. So it's right around Australia. conducted in multiple different sites, which meant that we did have a very good representative group, no question about it. And in WA, you can see those kind of sites, but it's in Northern Territory, right through New South Wales, right through Victoria, pretty well everywhere in Australia. So it's highly representative. We have to thank all of the specialist homelessness support services for that. What we found was this very high level of intergenerational homelessness amongst current adults in specialist homelessness support services. So it's a select group. This is not the overall rate of intergenerational homelessness in Australia. It is in that select group of those who are receiving support, but they're very, very high. Here, 50% of current adult homeless had homeless parents. What we also picked up on, because we asked questions about early onset, was this very high number of adults, and I picked it up in discussions and talking to people, on the streets and so on earlier, and that's why we asked the questions about when did you first experience homelessness, and again, this very significant number prior to the age of 18, with more in terms of Aboriginal and Torres Strait Islander adults talking about early experiences of homelessness. And this goes back to 8, 10, 12. So I kept on getting the stories from particularly men and women who were sleeping. First became homeless around about 11 or 12, kicked out of home, ran away from home. It was a very common experience. 56% ran away from home at some stage. Now, there was high interactions with the juvenile justice system as well. This was giving us a lot of clues about this form of homelessness. So you have this kind of idea that around about half of those adults experiencing homelessness are relatively new, but the other half have long experiences, and many have an intergenerational experience, and many have that children experience. And the issue with the children is very interesting. Catherine Robinson keeps on using the same phrase again and again, unaccompanied children. Unaccompanied, and she has to say it all the time, because children, that term children, factors into the homelessness discourse largely in only one respect, which is women and children escaping domestic violence. So you get that phrase, women and children escaping domestic violence. But they don't, you don't see the unaccompanied children's language used very much. And it's not a hidden problem at all. She's been talking about it for decades, really. But it is something that is not addressed properly. It is only very fundamentally addressed when that unaccompanied child actually gets into, say, the child protection system. Then they become a child in the child protection system. And people understand it, and I've got support workers around that. So it remains a big issue for us. Where did they go? They largely couch surf. And the number who said, when you left home, women's refuge with mum was an astonishingly small number, incredibly small number. So couch surfing and elements of street and park-based rough sleeping as well. So that got us into this policy. How do we deal with that question? When we did the cost of youth homelessness study, which was amongst not the very young, and this is an interesting part, when you look at the specialist homelessness support system data, you can only get it from 12 onwards, and largely 15 onwards. And so you have these numbers quoted, which aren't a true reflection of it's a true reflection of the data because of the way the data is organised. But so this is of the slightly older group, 15 onwards, 15 to 24, that we did in the cost of youth homelessness study, which also found those high costs as well, as you know. But the big issues around self-harm and suicide was so big in that study. And the links to our home care in that group was also really large. But to go back to that, the kids leaving home who aren't yet in the child support system or out-of-home care system, rather. This was a project that came up in Victoria, the Yarra Ranges, so Lilydale, Healesville, those kinds of areas up to the ranges. So this is not your inner city Melbourne group. This is outer suburb group. And just the experiences, these are of young people who then later did connect into youth services. But the interesting part about this study was the extent to which the children running away from home or thrown out of home, going couch surfing to friends, relatives, going back home, and we actually mapped it out, and they stay close to the school and their local community. It's only towards the end of that time period that you start to get the movement out of the outer suburbs to the inner suburbs for those who've had these very long histories, and that they then get picked up by the youth refugees and so on. So this was really important to say, this is happening out there in the suburbs. What is our policy response? Particularly around the younger children. One of the interesting facts that came out of this was, we asked the question, when did you first become homeless? Well, it was around about 2 years or so after their calendars suggested they were first homeless, so they weren't taking on that. They hadn't been, if you like, brought into the system to be able to say, actually, you're homeless. Oh, right. Because the image of homelessness is not of a young person that they have in their mind. So that was very interesting work, and we still need to focus a lot on. So moving towards the end now, just some cohorts. I'll talk about a couple of these cohorts that we've worked on. Again, this is of interest to us because we were concerned, this is now using advanced zero data around Australia, and women sleeping rough wasn't a group that had a particularly strong profile. At this stage, people are starting to really focus in on the new group of older women who weren't in this kind of category, although you absolutely do have older women on the streets. But this was a real concern, the high needs of largely younger women. So they were on average younger than their male counterparts sleeping rough. And what we found was elevated rates of violence on the streets towards women, elevated rates of mental health issues, elevated rates of use of healthcare facilities and so on, even relative to men in many cases, suggesting this is high need. And the need for a specialised response, because one of the things that the women were constantly talking about was the male violence on the streets, getting into groups, etc. So it needed a specialised response. The other thing that we did was to look at what women actually said they wanted in this and a number of studies, to do that qualitative coding as an important part of a policy response. What is it that you want? Not what we have for you. And what we have for you is housing. Well, no, housing is right at the top, but a lot of other things are coming in. With women, much more around reunion with children, safety, a place to sort out issues, to some extent employment with men, a lot more around employment, for example. Another group that there's been a lot of work on, of course, is women and children escaping family domestic violence. And the work with Adopted House was really important to us because of the fact that it's wraparound support. And it was also methodologically interesting because they did their own quality of life metrics. And the wraparound support and the broader kind of outcomes being measured allowed us to look at things like improved well-being, decreases in depression, anxiety, and stress. By the way, that was one of the factors that allowed us to talk about the validity of the love matrix, because they were doing the DAS and they created their own life matrix table, and there was high validity in that area. The last thing, this is
Sorry, it's 1:35, just so you know.
We are going to finish in 2 minutes. Another thing that came out, Ruben, was part of this. So the Atlas, where are the top 20 sites? It's Northern Australia in terms of the rate of homelessness, but Northern Australia is often missed out. That does go to rough sleeping, where Perth is also very high. To get to the end point, we believe that there should be a national plan, the WA plan. The SET and others were involved in the development of this homelessness in West Australia view. We've been very strongly engaged in the strategy to end homelessness by the West Australian Alliance to End Homelessness. That was a beautiful night. We launched the strategy. Anyone attend? I don't know what the answer is online, but but that was a great night when we launched the strategy, and we developed a measurement system around that, which was very detailed and drew on structural determinants, drew on issues around the need for higher collaboration as well as outcomes. So it was like this systems approach to evaluation, which I thought was very, very important. And just to end up, our Ending Homelessness in Australia report, which of course is what we're going to go back to, does deal with that structural, the complexity of homelessness, that there are structural drivers that you need to deal with, including, for example, a housing system that provides sufficient housing. But you do need to look at those individual lives and the different cohorts that you see. And you need a very nuanced kind of program. So in some cases for chronic homelessness, where the high rates of health problems and mental health issues may suggest a supportive housing model for a long period of time. In other cases, it's not that at all. And you need to look at the situation you faced. For all those young kids, it's a completely different kind of approach. Actually, you don't need any more housing there. You don't need it. You need to fix the issues around families and violence and so on in the local community, and you need schools to be engaged. So hopefully that's not too far off. Good. Okay, so any questions? Now we'll open, what we'll do now is we're going to have a look at the online group, of which there are hundreds online, and look a little bit at the chat. I have no idea what's been going on behind the scenes in the online group, but here we are. Hello, everyone. How are you? Good. So, do you want to do this? Have an on?
Yeah, I can if you want, but I feel like you
can do it. Yeah. So we can have a question from the audience face to face, and then go online. Yeah.
We've got just over 5 minutes, so it'd be great to any comments or questions.
I was just interested in how does WA compare to the eastern states with regard to the supported housing and outcomes, because I've just been 15 years in Melbourne, and I know worked in the not-for-profit area, and I noticed some of the issues are far more complex over there than what they might be here, but also too here. It seems to be totally different to me because of the spread of WA. So the housing isn't as compact, and there's no less ability to be able to, looking for jobs and that type of thing because it's so spread out.
Yeah, well, I think Perth is very similar. The difference between Perth and Melbourne would be the very high rate of Aboriginal homelessness. And the transformation in Perth in terms of Aboriginal community-controlled organisations moving into that sphere where previously it wasn't funded properly. The big issues around health and mental health, drug and alcohol use in terms of chronic homelessness are pretty much the same. And the movement into, with for example, the 50 Lives, 50 Homes program, and now the Zero project around WA, still largely in major regional areas and the city, has introduced a very strong housing first approach. So it's actually looking pretty similar to, say, your experiences in Melbourne. The difference would be, of course, the regions, as you say. And if the highest rates of homelessness in the main, it turned out that Perth was one of the 20 in the rough sleeping rate, a little distorted because Sydney had COVID during the census, so that was a bit distorting. But yeah, it is still largely a big issue in Northern Australia, in my view, and Northern Australia needs its own policies, particularly in broader homelessness around severe overcrowding.
May I?
Yeah.
It's just two questions connected. What do you reckon about the ESG agenda?
Yeah.
If it will helps or not? And I don't know if you talk and I misunderstood about the work job, if it helps to develop their autonomy.
Yeah.
Because that's what's happening in Brazil now. So we could introduce the formal market with the ESG agenda, the homeless, so they can develop their own autonomy and get less support from the public financial.
That's a very interesting point. The ESG agenda is largely, but not entirely, a corporate agenda in Australia. And the social part of that is very, very diminished. So there's a lot of work that corporates need to do in that agenda. So they tend to still focus on those things that are more regulatory, for example, anti-slavery stuff, which is regulatory for larger groups. But the employment side is a big issue. We've seen some good success in this, the triangulation with social enterprises, particularly for the young, both here in WA and elsewhere. I like the models like Common Ground and Brisbane having their own social enterprise. These are very, very important because there's no question that employment numbers have been way too low in homelessness programs, and employment and work provide very important social connections that give people money in their pockets. So maybe we can go online.
Any questions in the chat? Anyone online want to jump in with a question? Take your mic off mute and jump in.
There's a lot of people. Yes. 45. Was there anything in chat?
There are a couple of questions coming through on the chat. The first one says, do you have a specific strategy to grow the workforce needed to provide the level of service and support needed, given some of the current shortages in the sector?
That's a very, very good question. So work that we're doing with MISHA Australia is actually saying, okay, look at the forms of homelessness that we see and the need that we see, but what type of spend do you need to meet that need? And what kind of programs do you need to put in place? And there's definitely a broad range of programs. So if we're adopting, for example, Housing First, you need those who can provide the support on entry into housing. Given the experience, for example, that we saw in MISHA, where there was a high need for really strong caseworkers at that point. But we also need those with proper connections to business to help those connections occur. At the same time, if the story around the young, the unaccompanied children is correct, then not only do we need the youth refuge workers, but we need workers that are more connected to schools and communities. And unfortunately, probably there's been a shift of funding away from social workers in schools, where they would be more likely to pick this up. And so we need a stronger response there at the school level. We have programs like Reconnect was a classic program in that space that needed a lot more funding. We need specialised work in terms of rough-sleeping women. Yeah, just thinking about the cohorts that we're interested in, or not interested in, which we've done work in. Refugees and asylum seekers was another big cohort and that needed a lot of specialist work because we knew there was a big problem, but there was also a bit of reticence in coming forward. So you never found the true extent of that problem.
Time for just one more.
We do have one more online. This one's about the context of it is you mentioned women sleeping rough. and it thought that according to the last census, the fastest growing group is older women, this missing middle. And the question is, do you see a need for further research in that area?
Yeah, the issue of older women experiencing homelessness actually occurs from the previous census. So it wasn't this census, it was an issue that came up at the previous census. And a lot of case studies of this group that had been completely missed out. And generally speaking, looking at that question of very low financial resources, sudden movement, inability to pay rents and so on, and movement out with nowhere to go. And that group from 2016 census and so on created a very good advocacy platform. There was a great advocacy response from that finding from 2016. So the issue around older women's homelessness became prominent. And rightly so. What we were concerned about was that the women sleeping rough wasn't an issue that had taken the agenda. But you look at the rough sleeping group, and this is coming from the Zero projects around Australia. They represented around a quarter of the group, a big group, and they were actually younger than their male counterparts. And then when we looked inside their outcomes in health and mental health, drug and alcohol, use of emergency, but the violence that they were experiencing was so significant. So there needs to be an agenda around that. And we have found it difficult, just like Catherine Robinson and us have found it difficult, and we're so glad to be at the conference last week, a really great conference in Melbourne last week on children and youth homelessness, making sure, using that term, that there needs to be a focus on these kinds of groups. And certainly women sleeping rough is a big group that requires a specialist response.
Okay, so Margaret, who has sent everyone out the registration link, has said that if you have a follow-up question for Paul, please email her and you can continue the conversation face-to-face, but I think someone needs the room shortly. But I just want to thank you, Paul. That was amazing to, show us that the evidence base is not only there, but also improving and, over the decades, and I want to acknowledge your contribution to that as well, and also just say how generous and the teams around you.
People here in the audience who've worked on these projects. Yeah,
that's right, and there's also lots of work to do still. But yeah, as an expert on homelessness and all the work you've done, I think it's very generous of you to be able to sum it up in half an hour. And, I didn't get all the details, and I will go back to the slides, but, those key points really came through with clarity. So thank you very much.
And scattered site housing.
Thanks, everyone.